Infectious Disease Specialist in New Orleans, and he is here to implore us to get vaccinated if we haven't. The state's receiving 112,000 coronavirus vaccines this week. Dr. Akula, are we doing a good job?
Could be better, but nevertheless, I think we're making a good effort. And in this regard, I just want to remind your listeners, thank you again, for this opportunity. The state has actually reduced the criteria, so now anybody that's over 18 years of age with some medical conditions will be able to obtain this vaccination. So that's a great news.
Well, there have been reports that in minority communities, those vaccines are not as plentiful as there are elsewhere. And unfortunately, people of color are not getting vaccinated at the rates that others are. How do we address that?
That's an excellent question. Actually, as a matter of fact, Carla Brown, they just called earlier, she's been a leadership role, who's a director of nursing at Cannon Hospice, knocking on the door-to-door of this black and minority communities to urge them to go take the vaccine. I was kind of appalled at the statistics that I got from East Baton Rouge Parish, from the Louisiana Department of Health, that there is a big disparity where the blacks have completed 25% of vaccination, whereas the whites have gotten 62.39% completion. So that's less than half. And that's a significant difference. And I do believe that we got a very serious need to bring this herd immunity. So just like Israel, where they have used the Pfizer vaccine to inoculate their population that's over 95% vaccinated already, and have brought down the COVID death by 98%. So what I'm trying to bring that fact is that the real issue, I'm sure a lot of listeners know, Israel since 1947 had a conflict between Israelis and Palestinians, and they got both of them together and then got their vaccination more than 95%. I think we got to do the same thing right here. Black, white, other minorities, and everybody needs to pitch in. It's not an issue about, of course, there's nothing that can be done to, do something to address the racial inequality. But right now, there's a need for us to get this herd immunity up. Otherwise, we're all in trouble. So I think, we need to encourage leaders, like Carla and others in the community to come forward and help these, black and minorities to be told about, the need, for this protection against.
All right, let's go to Ray in Prairieville. Ray, be brief. You're on with Dr. Shiva Akula.
Thanks for taking the call, Jim. For Dr. Guba, the comment about the blacks in the community not getting as many, I'm very unhappy that I heard that there was only one place giving the vaccines in Baton Rouge.
All right. Well, what about location? Do they have adequate locations in these places? Isn't that a major reason why the numbers are what they are?
There is something that, it needs to be addressed. I'm sure that the state would get the message, listening to this conversation.
All right. And the governor will be with us Wednesday. We'll talk with him about it. Thank you, Dr. Akula.